Okay, ready for a deep dive. Today we're tackling arthritis, and from the looks of this stack of articles you've given us, we're going beyond just the basics. Should be interesting.
Well, what most people don't realize is that arthritis isn't just one thing. It's actually a term for over 100 different conditions that affect the joints.
Over 100. Wow, I had no idea. You always just think of it as like something that happens when you get older.
Right. Age is a big factor, especially for the most common type, osteoarthritis. But then you've got things like rheumatoid arthritis and the genetic factors there. Fascinating stuff.
Okay, so back up a sec. Arthritis is more like a category, not a single illness. What does that even mean for someone who's like actually dealing with joint pain?
It means getting the right diagnosis is crucial because we're talking about over 100 different conditions here.
Right.
Each one might have different causes, different ways of progressing, and most importantly, different treatments.
So basically, don't just brush off achy joints as getting old. Could be something else entirely. Now, our sources highlight osteoarthritis and rheumatoid arthritis as the big ones. Let's start with osteoarthritis, the wear and tear, kind of what's actually happening in our joints.
Think of it like this. The cartilage in your joints, it's like the cushioning, the shock absorbers. Over time, that cartilage wears down and you get bone rubbing on bone. That's what causes the pain, the stiffness, that feeling like things just aren't moving the way they used to.
Ouch, makes me cringe just thinking about it. And it's not just us, right? One of the articles said even dogs can get osteoarthritis, especially in their hips and elbows.
Exactly. It's incredibly common across species, too. And for humans, it's not always just age. Lifestyle plays a big role in how fast osteoarthritis develops.
Yeah, the overview mentioned things like injuries, being overweight, and even just not moving enough can all contribute. So even if we can't stop time, we can definitely have some influence over how our joints age. All right, let's move on to rheumatoid arthritis. This one seems a bit more, I don't know, complex and maybe even a little scary.
And for good reason. With rheumatoid arthritis, we're talking about an autoimmune disease. So your immune system, which is supposed to protect you, ends up attacking your own body. In this case, it's the lining of the joints that gets targeted. And you're right, genetics play a big role here.
Yeah, that PDF on rheumatoid arthritis genetics really went deep. There was this one gene, HLA-DRB1, that kept coming up. Seems like if you have a parent or sibling with rheumatoid arthritis, your risk goes way up, like 3 to 5 times higher.
Exactly. Those HLA genes are really important for how our immune system figures out what's a self cell and what's a foreign invader. But in rheumatoid arthritis, and particularly with certain versions of that HLA-DRB1 gene, the signals get mixed up. The body starts seeing the joint lining as a threat.
So it's like the immune system gets confused and starts attacking its own team.
That's a great way to put it. But, and this is important, even if you have a genetic predisposition, it doesn't mean you're definitely going to get rheumatoid arthritis. Environment matters too.
Okay, that's a relief, honestly. What kind of environmental factors are we talking about here?
Well, smoking is a big one. Especially if you already have those HLA-DRB1 risk variants. Think of it like this. You've got these genetic switches that might make you more likely to develop rheumatoid arthritis. And smoking. Smoking is like flipping those switches on.
Both that PDF and the general arthritis overview really emphasize the smoking connection. Sounds like a bad combination.
Absolutely. But it really illustrates how our genes and environment work together, right? Just because you have a certain gene doesn't mean you're destined for a particular outcome. Lifestyle choices can have a huge impact.
So even with a family history, you're not doomed. There's still a lot you can control. Okay, we've covered the 2 most common types, but that still leaves, what, like 90 plus other kinds of arthritis? Where do we even go from here?
Remember how we said arthritis is like a category? It's like we've just explored the osteoarthritis and rheumatoid arthritis sections of a massive library on joint conditions. There's a lot more to discover, and some of it might surprise you.
Ooh, I do love a good surprise. All right, hit me. What else is hiding in our joint health library?
Well, there's gout for one.
Yeah.
That's when you get this sudden, intense buildup of uric acid, often in the big toe. We're talking some serious pain, the kind that makes you want to chop your foot off.
Ooh, gout. I've heard horror stories. It's kind of wild how such a small body part can cause so much agony.
Right. Reminds you that even the little parts can pack a punch when it comes to pain. Speaking of connections, there's also psoriatic arthritis, where you're dealing with both joint pain and the skin condition psoriasis.
Oh yeah, I actually know someone who has that. It's amazing how connected our skin and joints are. You wouldn't necessarily think they'd go together, but it shows how complex the body is.
Exactly. And then, of course, you've got infectious arthritis, which, like the name suggests, is caused by, well, an infection. Could be Bacteria, viruses, even fungi setting up shop in the joints.
Okay, that one sounds kind of terrifying. I'm guessing quick treatment is pretty important there, right?
Absolutely. With infectious arthritis, you got to catch it early to prevent lasting damage. And the fact that some forms of arthritis can be triggered by things like Lyme disease or even hepatitis, it really underscores that joint pain isn't always its own isolated thing. It can be a symptom of something much bigger going on.
Wow, it's like a whole body puzzle with the joints holding clues. Okay, so we've got osteoarthritis, the wear and tear kind, rheumatoid arthritis, where the immune system's gone rogue, and then this whole other category triggered by infections or even other underlying conditions. Man, arthritis is way more complex than I realized.
It really is.
Yeah,
And that complexity extends to treatment, too.
right. I mean, with so many potential causes, where do you even begin with treatment?
It always circles back to that first crucial step, getting the right diagnosis. Once you know what type of arthritis you're dealing with, then you can start exploring treatment options that actually make sense for your situation.
Our sources mention medications, physical therapy, even assistive devices to manage symptoms and, improve quality of life. And of course, the old standbys: healthy weight, regular exercise, good diet, all that jazz. But what about a cure? Is there hope for a future without arthritis?
Well, sadly, there's no magic bullet cure, at least not yet. But there is hope. The future of arthritis treatment is a really exciting area of research. Your sources actually hinted at some really cool stuff on the horizon.
Okay, I'm always down for some good news. What kind of breakthroughs are we talking about?
Well, remember those HLA genes we talked about earlier, the ones linked to rheumatoid arthritis?
Yeah.
As scientists learn more about the genetics behind it all, it opens up the possibility of personalized medicine.
Ooh, personalized medicine sounds fancy. So, like, tailoring treatments based on your unique genes?
Exactly. Imagine knowing which genes make someone more likely to get a certain type of arthritis or which medications would work best based on their DNA. That's the kind of potential we're talking about.
Wow, that would be incredible. No more guessing games with medications, just targeted therapy right off the bat.
Right. It's still early days, but the possibilities are super exciting. And it's not just genetics that's getting attention. Your articles also talked about gene editing as a potential avenue for treatment.
Okay, now that sounds like something straight out of a sci-fi movie. Are we talking about actually editing out the genes that cause arthritis?
Well, that's the long-term goal, but it's definitely a complex and ethically challenging field.
No kidding. But still, it's pretty mind-blowing to think that scientists are looking at ways to potentially rewrite our DNA to prevent these conditions.
It really pushes the boundaries of what we thought was possible. But even with those cutting-edge advancements on the horizon, we can't forget about the power of what we can do right now.
Right. Easy to get caught up in the future of medicine and forget that sometimes the simplest solutions are right in front of us.
Exactly. Taking care of our joints through exercise, maintaining a healthy weight, eating a balanced diet, those things can make a real difference in how our joints feel today.
So empowering to know that we have some control, even without a cure. Makes you wonder, though, with all the advancements in medicine and technology, what other breakthroughs might be just around the corner?
It's a great question. And it leads us to another fascinating area of research that might hold some surprises when it comes to arthritis: the microbiome.
The microbiome. Wait, you mean all those trillions of bacteria living in our gut? I thought that was mostly about, like, digestion and stuff. How does that tie into arthritis?
Well, we're learning more and more about how the gut microbiome actually plays a role in inflammation throughout the body. And inflammation, as we've been talking about, that's a key player in a lot of arthritis, especially rheumatoid arthritis.
So you're saying if we could somehow, like, change the microbiome, maybe through diet or probiotics or even like those fecal transplants you hear about, could that potentially help manage arthritis symptoms?
That's the big question, isn't it? It's still a pretty new area of research, but definitely promising. Imagine, right, a future where, along with traditional treatments, we're also taking care of our gut health to support our joints.
Wow, that would be amazing. Really goes to show, even with all our fancy technology, we're still just figuring out the human body.
Absolutely. And that's what makes it all so fascinating. There's always something new to discover, new connections to be made, and hopefully more effective ways to treat and maybe even cure these conditions.
Well, you've definitely given us a lot to think about. The sheer variety of arthritis is mind-blowing, honestly. It's not just one thing. It's this whole spectrum of conditions, each with its own quirks and challenges.
Exactly. And that's why it's so important to get informed, figure out what type of arthritis you might be dealing with, and work closely with your doctor or a specialist to find the best treatment plan.
So true. Having access to good information, like what we've been looking at today, that's so important. Knowledge is power, especially when it comes to your health.
Couldn't agree more. The more you know, the better equipped you are to advocate for yourself, ask the right questions, and make choices that support your overall well-being.
So, for our listeners who are ready to dive deeper into the world of arthritis, maybe for themselves or someone they love, where would you steer them for reliable information?
The Arthritis Foundation is always a good bet, the National Institutes of Health, and of course, your doctor is always the best resource for personalized advice.
Great advice. Well, we've covered a lot of ground today, from the different types and causes of arthritis to the latest research and potential breakthroughs. But the big takeaway, knowledge is key when it comes to managing these conditions and taking charge of your joint health.
It's been a pleasure exploring this with you.
Likewise. And to all our listeners out there, we hope this deep dive has left you feeling empowered and informed. Until next time, stay curious, keep learning, and take good care of those amazing joints.
Together as one whole, each part playing its own